Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and delve into the challenges and impact of each technology in practice. This is the Medtronic MedEd Learning Experience. No monitoring system should be used as the sole basis for diagnosis or therapy, and they are intended as an adjunct in patient assessment. Reliance on a single monitoring system alone for patient management is not recommended. The contents and conclusions of the following programs are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers receive funding from Covidian LP, a Medtronic company, for this speaking engagement. Medtronic's medical education programs are offered to provide attendees education on FDA-cleared indications and use of our products when applicable. For this segment of the series, a discussion on patient safety and procedural sedation. What is respiratory compromise? To help answer this question are CRNA Brian Berry and sedation nurse Linda Erfle.
Okay, Brian, so why don't we start out by asking the question, what is respiratory compromise?
Hi, Linda. Thanks for asking me the question. This is a topic that I'm very passionate about. I love the topic of respiratory compromise. It's near and dear to my heart. So, defining respiratory compromise, I define respiratory compromise as a patient decline in respiratory function, in which there's a high likelihood of respiratory failure and arrest. But the good news is, if you intervene quickly and recognize it quickly, you can prevent those respiratory events from occurring.
That would be the best case scenario there, but that doesn't always happen in real life. I wish we could work together every day. What are your thoughts on the apneic episodes during procedural sedation?
Yeah, and you can see it right in front of you. I mean, respiratory compromise is a very common problem, actually over 50%. So 1 out of 2 procedural sedation cases, there's an apneic episode in the patient. So very common. In the cath lab, 62% of patients undergoing moderate sedation have an apneic episode. In the ED, 70% of patients have respiratory depression. So this is a common problem. And the key was that definition. If you recognize it and intervene, you can prevent full-blown respiratory failure and arrest and some apneic episodes in these patients.
Okay, excellent. What about pulse ox monitoring? It's considered the mainstay in respiratory monitoring. What are your thoughts on this? Is it enough?
No, it's not. Pulse oximeter is a very critical monitor. I view breathing as a 2-piece puzzle. So there's 2 pieces in the puzzle. One side of the puzzle is your oxygenation, and that's measured via the pulse oximeter monitor. So this second piece of the puzzle is ventilation, and that's measured via carbon dioxide and with the capnography monitor. So you need both pieces of that puzzle to see the whole picture of how your patient's breathing. So if you're just using the pulse oximeter monitor, you're missing half of the puzzle. And it's important to note that the pulse oximeter actually lags in seconds in comparison to the patient's clinical status when they're having respiratory compromise. So in other words, the numeric value that you see that's on the pulse oximeter monitor may not be the clinical situation that the patient is actually having.
Okay, so you mentioned this second piece of the puzzle, the capnography monitor. Describe how it actually detects respiratory issues faster.
Well, I always like to challenge the audience and people listening on this topic to do an exercise. We can all do it together. You connect yourself to a pulse oximeter monitor, and you connect yourself to an end-tidal CO2 monitor. And then I tell the patients or people to breathe normally, and then hold their breath. So connect yourself to both the pulse ox, the end-tidal CO2, hold your breath. When you hold your breath, the instant you hold your breath, the capnography monitor will go flatline. Will tell you instantly when a patient or yourself stops breathing. The pulse oximeter monitor will continue to function, and for seconds, you'll see normal numeric values. And what publications and literature and studies after studies say is this is not just seconds, it's minute or minute and a half. If you have a healthy swimmer that's really young and extremely fit, it could be longer than that. So the clinical situation that the patient is in versus what the numeric value of the pulse oximeter presents itself with could misalign. And that's what we're talking about: detect early and act fast. If I told the audience that they could be 23 times faster, 23 times stronger, 23 times better at something, you think everybody would jump up. Well, that's what literature says. You're 23 times more likely to detect respiratory compromise using capnography compared to just the pulse oximeter monitor.
Wow. It sounds like I want to go to work and put my pulse ox on and my EtCO2 tubing and hold my breath. That would be something fun.
Thanks, Linda.
Thank you, Brian.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.